when you bleed, there is healing and all that. It could lead to tuber block.
Hello, everyone. You're welcome to another episode of Fertility Expo Room. I am Priscilla Sawe. Today, we are talking about a condition that can affect a woman's health and fertility, which is endometriosis. We have our specialist back with us to talk about endometriosis and to answer some important questions. We're glad to have you back, Doctor. Now, Doctor, what is endometriosis and what could be identified as the cause of this condition?
Endometriosis, like we commonly say, is a medical enigma. We call it enigma. It's like a mystery because we are yet to know the exact cause of endometriosis. What it simply means is that the tissue found lining the uterine cavity is found elsewhere instead of strictly remaining within the uterine cavity. It is just like today, tomorrow, you now find that, oh, your skin, the way your skin is now found in your mouth. A kind of ectopic endometrial tissue found outside the womb. Commonly, it is in the pelvis, around the ovary. As a matter of fact, at times it forms cyst, what we call endometrioma. And because this tissue bleeds monthly, you'll see these women having pain. They will be menstruating from that site. When the womb is supposed to menstruate and bring out blood, you see bleeding coming from such sites because they have the same origin, so to say, the same type with what is in the uterine cavity. And when that happens, the patient feels pain. Okay? So one of such signs or symptom is that during menstruation, this patient continues to have pain. This pain comes with menstruation and at last menstruation. And the pain is usually severe. Is some other very complicated situation. You have it in the lungs. Some persons have it on their navel. It is actually a very terrible situation and can cause a lot of distress to a woman with such a condition.
Moving on, Doctor, what impact can this condition have on a woman's reproductive health?
Now, because after bleeding, like when you bleed, there is healing and all that, it could lead to tuber block because it's in the pelvis around the region of the fallopian tubes. Anytime the woman bleeds and during menstruation, and then bleeds again, over time, there's formation of scars. Okay, these scars could end up blocking the tubes, and so the woman will have tuber block. Okay, and tuber factor infertility. But because one of the commonest sites where you find this tissue is in the ovary, it can also affect the quality of the eggs. And so such women may have problems getting pregnant.
Doctor, could you please explain the different stages of endometriosis and how they vary in severity?
This condition has different degree of severity. Some have mild, to be superficial. Okay? Some have deep and extensive ones. But depending on how severe it is, okay, the more severe ones are easier to detect. Like those ones that have cysts from this, we call them chocolate cysts because when you check the component, they're like the chocolates. So we call them chocolate cysts. And when you scan them, you are also able to easily identify this cyst, endometriotic cyst. Okay, so it is easier. But for those who have superficial, very mild form, you have to do what we call laparoscopy. On laparoscopy, you are able to see this tissue, staining the peritoneum, okay, staining the internal lining of the abdominal cavity. Okay, we're able to identify it.
Now, Doctor, this condition is a very huge threat to lives, particularly the women. What more can be done to improve awareness, early diagnosis, and treatment of endometriosis?
By the time you see that you're always having this severe pain during menses, and if even after menses, the pain continues for some time before it's eventually, you have to see your doctor. Okay? There is usually nothing you can do on your own. You must see your gynecologist. And your gynecologist is better, actually is in a better position to recommend for you the treatment modality that is suitable for you. There are medications that can relieve it. Okay? The treatment can be symptomatic. For instance, you have symptoms, disturbing symptoms, that can give you pain, something for pain. All right? But the cure right now is actually to a size, through laparoscopic procedure, to a size tissues. I have gone for this kind of training in Kenya, interestingly, where the last one was the Healing Mama Africa, where endoscopic surgeons all over the world, from America, Brazil, Asia, and all of us were gathered. And the next version of this conference is going to hold in Kigali. Okay, and by the grace of God, we'll be hosting the 2028 version in Asaba, in our Asaba Center in Nigeria. Okay, uh, everybody is trying to make sure, that our mothers are not left to suffer from this condition that has actually remained a threat to their, well-being. That's what we mean when we say healing Mama Africa. Healing Mama Africa from the grips of endometriosis.
That brings us to the end of today's episode on Fertility Expo Room. A very big thank you to you, Doctor, for sharing your knowledge. Thank you to our viewers for watching. My name again remains Priscilla Sawe. Join us in our next episode on Fertility Expo Room. Until then, stay blessed, stay hopeful.